Hi, today we're going to be talking all about hysterectomy. I'm Dr. Jani Manoharan, laparoscopic surgeon, robotic surgeon, infertility specialist, obstetrician and gynecologist. Let's dive right into the topic. So what is a hysterectomy? A hysterectomy is a surgery done to remove your uterus. There are different ways in which it can be done and different types of hysterectomy. More on that later. First of all, let's discuss about why a hysterectomy is done. So some of the reasons for which your gynaec can suggest a hysterectomy to you is you can have masses in your uterus which may be causing pain for you, or it may be causing a swelling of your tummy, and there may be difficulty in passing urine and passing stools. You can also have heavy bleeding which is not responding to other modalities of treatment, and the hysterectomy can also be suggested for other causes like cancer of the cervix and cancer of tubes or ovaries. And as for the types of hysterectomy, hysterectomy is a total hysterectomy in which we remove the uterus, the neck of the womb and the cervix, the neck of the womb or the cervix. And a subtotal hysterectomy in which the uterus alone is removed and the neck of the womb, that is the cervix, is left behind. If a subtotal hysterectomy is done for you, your gynecologist will be informing that the cervix is left behind and you should be continuing to do screening for cancer cervix. And there is also another type of hysterectomy in which we remove the uterus, the neck of the womb, that is the cervix, the tubes and either one or both of the ovaries. This is called a total hysterectomy along with salpingo-oophorectomy. So which type of hysterectomy is done for you depends on the condition for which the hysterectomy is being suggested for you, your health condition, and also the factors like if you've had any previous surgeries and how difficult your present surgery is. As for the ways in which a hysterectomy can be performed, it can be performed either abdominally, vaginally or laparoscopically. So abdominally, what we do is we make a cut on your tummy. It can be a transverse cut or a vertical cut. The cut is usually about 10 to 12 centimeters in length, and we will be going ahead with the surgery. And laparoscopically, what we do is we put in a small camera into your tummy. We have a look at your entire tummy and we go ahead with the procedure. You will have about 3 to 4 cuts which is extending about 1 to half a centimeter in length in your tummy. And vaginally, what we do is we do the entire procedure through your vagina. It's similar to like how you're giving birth during your normal delivery. The type of hysterectomy that is going to be suggested for you depends again on the cause for which the hysterectomy is being suggested in the first place, your health parameters, and also your previous surgical status. As for the after effects of a hysterectomy, the after effects of hysterectomy as such, there is not much of a after effect, though it is of course a very emotionally and physically demanding procedure. So it would help if you have a lot of support and the entire process is a little hassle-free. It would help for your recovery as soon as possible. So as for the procedure in itself, like I told you, there are different ways in which we do the procedure. So the recovery also depends on the type of surgery that has been done for you, as well as your prior health status before getting into the surgery. And usually, by and large, what we expect of a patient is we would admit you the previous day in the hospital, wherein we can have a full health checkup and see if your lungs and heart and other organs can withstand the stress of anesthesia and the surgery. And the surgery in itself will generally take about 1 to 1.5 hours, again depending on the cause and your prior health status for which the hysterectomy is being done. As for the recovery after the surgery, abdominal hysterectomy patients by and large, they do recover. They take about 4 to 5 weeks to recover and get back to their daily activities. And if you're having a laparoscopic hysterectomy, because the cuts on your tummy is much lesser and the stress is much lesser, people usually get, on an average, women do recover within 2 weeks. And also your stay in the hospital, if you're having a laparoscopic surgery, by and large we try to discharge the patient on the same day in itself, or at the max the next day. But if you're having an abdominal or vaginal hysterectomy, we'll expect for you to stay in the hospital for about 2 to 3 days. And going back to many women do ask me, madam, when can I resume my sexual activity? We usually try to tell them to take it slow, and it takes about 6 to 7 weeks for you to get back to your sexual activity. As for the stitches on the tummy, we generally by and large use absorbable stitches, so you don't have to come back to the hospital to remove the stitches. These stitches either get absorbed in the body in itself, or they kind of fall off in about 3 to 4 weeks time. And we also do have stitches in the vagina, which some patients do say that they see some stitches coming off. Don't worry, it's nothing to get worried about. It's only the vagina healing. And post-surgery, some women do have a little bit of spotting for a few days, which is normal by and large, not to get worried. And some women do complain of having a gush of bleeding after 10 days or so after the procedure, which also by and large is normal, not to worry about. Now let's talk about the red flag signs for which you have to come back to the hospital after a surgery. So the red flag signs are if you develop a fever or if you develop any foul smelling discharge either from your wound on your tummy or from the vagina, or you have heavy bleeding that you'll have to use 2-3 sanitary napkins, and also if you have problems passing urine and passing stools. So these are the red flag signs for which we would expect you to come back to the hospital and for us to have a look at the tummy and the vagina. And after the hysterectomy, if you have some spotting, we generally advise the patient to use sanitary napkins and try to avoid tampons, basically inserting anything into the vagina that can harm and injure the vagina again. As for the anesthesia during the procedure, we either use general anesthesia wherein you put completely to sleep, or we use regional anesthesia wherein only waist down you will not have any feeling. The type of anesthesia again depends on the cause for which the hysterectomy is done and your prior health status. This would be decided by the anesthetist and they can have a discussion with you regarding the anesthesia before the surgery. And recovery from the anesthesia, modern anesthetics are very advanced and most of them do not have any after effects beyond 24 hours as such. The anesthesia will wear off by and large within 24 hours. If you're given general anesthesia, you will be drowsy and weary for the first 24 hours. We do suggest you not to drive or take important decisions and have someone with you during this first 24-hour period, after which you can get back and resume your normal life. That's it about hysterectomy. If you have any doubts that you'd like clarification on, please write down below in the comments. Thank you so much for watching.
Book your surgery appointment on pristyncare.com. Pristyn Care.